Welcome to the Deep Dive. Today we're plunging into a market that, well, became undeniably critical during the pandemic. Healthcare personal protective equipment, or PPE.
Absolutely critical.
Now, many might assume that demand has maybe plateaued or, even dropped off now that the global health crisis has, for many people, sort of receded.
Right, that's a common thought.
But our deep dive into the global healthcare PPE market forecast 2021-2033 by Cognitive Market Research actually reveals a much more surprising story.
It does indeed.
So our mission today is really to cut through the noise, pull out the truly important insights, and understand the continued strategic growth of this vital sector.
And that's exactly it. PPE isn't just about crisis response anymore, not at all.
No,
It's
right.
truly become a foundational, evolving part of global healthcare infrastructure.
Right.
And understanding the numbers from this report, it gives us a crucial shortcut, really, to being well-informed about where this market is headed, and importantly, why those trends matter for healthcare systems and, frankly, everyday life around the world.
Okay, let's unpack this then, starting with the big picture. What's the overall story for the global healthcare PPE market? Is it still expanding, or are we seeing a slowdown, like some might think?
It's definitely still expanding, and quite significantly, actually.
Right.
Yeah. The report shows that back in 2021, the global healthcare PPE market brought in just over $14.1 billion in revenue.
Okay, 14.1 big.
And that's projected to grow to nearly $16.8 billion by 2025.
Right.
And then it really seems to accelerate, reaching a substantial $23.6 billion by 2033.
Wow, 23.6 billion. That's quite a jump.
It is, and this represents a very steady compound annual growth rate, or CAGR, of about 4.4%, 4.362% to be precise, over that entire period.
Those were pretty consistent growth.
Very consistent. And what's fascinating here, I think, is that this isn't just a post-pandemic ripple effect.
Right.
It reflects a long-term sustained growth. It seems to be driven by a heightened global health awareness, evolving regulatory standards, and an ongoing commitment to infectious disease preparedness.
So it's more of a fundamental shift, not just a temporary surge.
Exactly. That's the key takeaway.
That is a crucial takeaway. It's not just that post-pandemic peak, but sustained growth. Okay, and here's where you mentioned it gets really interesting. The report calls the Asia-Pacific region a powerhouse.
It does.
Why is APAC showing such, explosive growth compared to the global average? What's happening there?
It's truly remarkable. Asia-Pacific's market was roughly, $6.7 billion in 2021?
Okay.
And it's forecast to surge to over $11.8 billion by 2033.
Over 11 billion.
Yeah, with an impressive CGR of nearly 4.9%, almost 5%.
Higher than the global average, then.
Definitely. Now, within APAC, China, it remains the largest market. It's expected to grow to about $3.6 billion.
Still huge.
Absolutely. But what truly stands out, and the report really emphasizes this, is India.
India. Okay.
It's projected to be the fastest growing market globally within this specific segment.
Globally. Wow.
Yeah, its revenues are climbing from around $780 million in 2021 to a really robust $1.5 billion, over $1.5 billion by 2033. That's boasting an incredible 5.8% CAGR, almost 6% annual growth.
Nearly 6%. What's driving that in India specifically?
Well, the report suggests it's fueled by a few things. It's rapidly expanding healthcare infrastructure, for one.
Right.
Also, increasing population health awareness programs, and a significant surge in domestic manufacturing capabilities that really emerged post-pandemic.
So they're building out their own capacity.
Exactly, building it out at an accelerated rate. And Southeast Asia is also showing very strong growth, too, nearing $900 million by 2033. So the whole region is booming.
That's a staggering jump for India. I might have assumed, North America or Europe would still be dominating in terms of growth rates.
It's easy to assume, but the numbers point east.
Interesting. Okay, so moving from the largest region, let's look at South America. The report points to robust developments there. What kind of momentum are we seeing?
South America is indeed showing strong, consistent momentum. Yeah, robust is a good word for it. The market there is growing from about $820 million in 2021 to over $1.4 billion by 2033.
So still significant growth.
Definitely, with a healthy CAGR of nearly 4.7%. So again, above the global average slightly.
Right. And within South America.
Brazil is the clear leader in the region. It's forecast to reach over $570 million by 2033.
Okay.
And Argentina is showing particularly significant growth. It's climbing from about $135 million to nearly $250 million.
Oh, it's doubling.
Pretty much, posting an impressive 5.2% CAGR.
Wow. Okay.
And this growth, it seems to reflect increasing healthcare investments across the board and just a growing focus on health and safety across the continent generally.
So we've covered the really rapid growth of APAC and the robust growth in South America. Now, what about the more established markets many of us are familiar with, North America and Europe? They're noted for a strong comeback.
Right.
How are these regions performing, and what does comeback sort of imply here? Was there a dip?
Well, comeback might refer more to settling into a sustainable growth pattern after the extreme surge during the pandemic peak.
Ah, okay. Not necessarily a dip, but finding a new normal.
Exactly. These are key players that saw those initial massive surges, and now they're settling into strong, sustained growth paths.
Got it. So North America.
For North America, the market is expanding from just under $3 billion in 2021
Okay.
to over $4.5 billion by 2033. That's with a CAGR of about 3.5%.
Still solid growth, but a bit slower than APAC or South America.
A bit slower, yes, but still very solid growth on a large base. The United States clearly dominates this region, accounting for the vast majority of that growth.
No surprise there.
No. While Canada also shows solid expansion, nearing $450 million by 2033, with a CAGR around 4.4%, actually.
It's kind of interesting for Canada. And Europe. Similar story.
Pretty similar, yeah. Europe's trajectory shows growth from about $2.7 billion in 2021 to over $4.2 billion by 2033.
Right.
That's at a CAGR of roughly 3.9%, so slightly faster than North America overall.
Okay. Who leads in Europe?
Germany leads the pack here. It's growing to over $900 million.
Mm-hmm.
Other significant contributors include the United Kingdom, nearing $675 million, and France, reaching almost $570 million. Italy and Spain are also strong performers mentioned.
Right. So strong growth across the major European economies.
Generally, yes. But what's interesting to note, however, is Russia.
Yeah.
Russia has the slowest growth in the region, according to the report, only climbing from about $117 million to just $146 million by 2033.
That's very slow growth.
It is, with a notably low 1.96% CAGR, just under 2%.
Any reason given for that?
The report suggests this slower pace in Russia is likely influenced by, well, economic and geopolitical factors that are impacting investment and market stability there.
Right, that makes sense given the context. Okay, that distinction is quite insightful. So, to round out our regional analysis, let's look at the Middle East and Africa. The report highlights these for emerging opportunities. What's the story unfolding there?
Right, the emerging opportunities. So in the Middle East, the market is growing from nearly $495 million in 2021.
Okay, about $500 million.
Yeah, to about $850 million by 2033. That represents a CAGR of about 4.6%. Pretty strong.
Solid.
Saudi Arabia is a significant player here, projected to exceed $218 million of that.
Okay. And Africa.
Looking at Africa, the market collectively grows from about $438 million to over $746 million. That's with a CAGR of about 3.9%. So decent growth there, too.
And key countries within Africa.
Within Africa, South Africa stands out. It's growing to over $315 million. And Nigeria also shows good growth, reaching about $120 million by 2033.
Okay.
It seems these regions are, developing rapidly in terms of healthcare infrastructure, and increased healthcare investment alongside rising health awareness is really driving their growth in PPE.
So we've gone around the globe now, seen some really dynamic growth in Asia, solid momentum elsewhere. What does this all mean for you, the listener? How do these regional numbers kind of weave into the bigger picture of healthcare and, well, our lives beyond just market size?
Yeah, that's the crucial connection, isn't it? If we connect all these dots, this regional data, to the bigger picture, it becomes really clear that the stable global growth path for healthcare PPE isn't just about, market forces or even just recovering from a specific pandemic.
Right.
It truly reflects a worldwide commitment, it seems, to rising healthcare awareness, the implementation of increasingly stringent safety protocols, and the ongoing profound impact of infectious disease preparedness. We learned lessons.
We certainly did.
And these trends, they highlight precisely where global health priorities are shifting.
Hmm.
It's moving towards a more proactive, preventative approach to public well-being and safety.
So governments, healthcare providers, they're fundamentally reevaluating and investing more in protection.
That seems to be the case globally, yes, investing in that baseline protection.
Right.
So maybe just to reiterate the key takeaways for everyone.
Yeah, let's summarize.
The global healthcare PPE market, it's firmly on a stable, long-term growth path. That's number one.
Okay, not a blip.
Not a blip, and it's driven by these critical factors related to public health and safety, not just temporary surges. We've seen the standout, truly explosive growth from Asia-Pacific, especially India,
Yeah, that was striking.
robust developments in South America, and a strong, sustained sort of comeback or normalization from the established markets in North America and Europe.
Okay.
It really is a global story of increasing preparedness.
This deep dive definitely shows us a clear trajectory for healthcare safety and investment. What this analysis truly highlights for you listening in is not just market expansion, right?
No, it's more than that.
It's also about the immense opportunities.
Yeah.
Opportunities for innovation in health tech, maybe better materials, smarter PPE, optimizing the global supply chain for this vital equipment, making it more
Now,
resilient,
for sure.
and strategic investment in public health infrastructure worldwide. So, considering these trends, here's something to think about. What innovations do you think will emerge from this growing global demand for protection, and what will that mean for how we approach health and safety in the coming decade?
Welcome to the Deep Dive. Today we're jumping into a sector that, well, it's really become central to global health conversations. Healthcare personal protective equipment, PPE. It's a fascinating area, isn't it? Caught between that immediate need for protection and these bigger questions about sustainability and just, well, human comfort for the wearers.
Absolutely. It's a real balancing act.
So our mission today, to unpack how everyone involved, innovators, manufacturers, healthcare systems, is navigating this pretty complex landscape.
Right.
We're digging into some comprehensive market research here, and it really shows how healthcare PPE is evolving. It's not just small tweaks. It feels like a fundamental shift.
It really does.
Okay, let's get into it. Looking at what's driving this market, beyond the obvious headlines from the past few years, what's been the biggest change in how healthcare settings view safety?
Well, I think what's truly foundational is the deepening awareness among medical professionals themselves. It's really shifted.
How so?
It's not just ticking a box for compliance anymore. It's more like an ingrained understanding of the risks,
Yeah.
infection, exposure.
Right.
And this heightened awareness is not abstract.
Yeah.
It directly fuels a steady rise in demand for specific things. Gloves, sure,
Okay.
but also advanced masks, specialized gowns, face shields.
Mm.
You really see hospitals, clinics, even outpatient centers embedding staff safety deep into their operations now, especially in those high-risk zones,
Yeah.
ERs, surgical suites, isolation units.
Yeah.
They get that protecting their staff is absolutely key to protecting patients.
And it feels like the shift wasn't just gradual, was it? It feels like it was, I don't know, accelerated, especially thinking about recent global events.
Oh, absolutely. Accelerated is the right word. The increase in infectious disease outbreaks and pandemics, that was a pivotal and, frankly, a pretty brutal global wake-up call.
Yeah.
COVID-19 obviously put PPE front and center globally.
Mm.
But what maybe gets overlooked sometimes is how it simultaneously exposed the surprising fragility of our global supply chains.
Good point. The just-in-time model.
Exactly. Built on just-in-time delivery. It showed that even a seemingly minor disruption could leave frontline workers incredibly vulnerable.
Right.
And that experience, plus, the ongoing emergence of new viral threats, antibiotic-resistant bacteria, it's pushed healthcare systems. They've moved from being reactive to proactively building up PPE stockpiles, enforcing much stricter usage protocols. It's about future-proofing, really.
That makes total sense. So it's not just individual hospitals reacting, but there's this bigger picture to the regulatory side. How much do mandates and compliance standards really shape the market, beyond just driving up basic demand?
That's a really important layer. You've got these big international bodies, OSHA,
Yeah.
the CDC, the WHO. They aren't just making suggestions. They are mandating the use of certified protective gear in medical settings.
Okay.
But it's actually more than just pushing for higher usage. These regulatory frameworks are critical because they also ensure, or try to ensure, product quality and performance.
The quality control aspect.
Precisely. So when healthcare institutions, everything from a local nursing home right up to a major surgical center, have to adhere to these stringent standards, it creates this really robust, consistent demand. But it's demand for high-quality, reliable PPE. You just can't bypass it.
Okay, so those are some powerful drivers pushing growth. But like any market that grows this fast, there have got to be significant challenges, right? Let's shift gears. What about the upstream issues? The hurdles facing manufacturers, especially with raw materials.
Yeah, this is where you really see the vulnerabilities surface. PPE production, it relies heavily on very specific materials, things like latex, certain synthetic fabrics, and especially polypropylene, specifically that melt-blown polypropylene needed for N95 type masks.
Right, I remember hearing about shortages of that.
Exactly. And the challenge is the production for many of these specialized inputs, it's concentrated in just a few regions globally. So any kind of global disruption could be geopolitical instability, trade disputes, even a localized natural disaster hitting a key production zone. It can drastically affect both the availability and the cost of these essential inputs.
And that trickles down.
Directly. It means higher procurement costs for the manufacturers, which then leads to, for healthcare facilities, an inconsistent supply chain and often, inflated prices.
Yeah.
It's a systemic risk baked into the current model.
Wow, okay. And speaking of systemic issues, that sheer volume of single-use PPE, the environmental impact must be enormous. What are we really looking at there? What's the ecological footprint?
Oh, it absolutely is a massive concern. The industry's heavy reliance on single-use items, it's just led to this alarming increase in medical waste.
You see pictures of it sometimes.
Yeah, and we're talking overflowing landfill, sure, but also this growing problem of microplastic pollution finding its way into, well, everywhere. Ecosystems, waterways. And beyond the visible waste, there's this sort of hidden cost. Incineration releases harmful emissions. There's the energy footprint of constantly manufacturing and transporting these items globally.
Right.
And while, yes, many institutions are exploring sustainable alternatives, reusable options, greener materials, the unfortunate truth right now is that these solutions are often limited.
How so? Limited by what?
Mostly by cost and, crucially, infrastructure. Think about sterilizing reusable PPE properly. That requires specialized equipment, specific processes, dedicated space. Many facilities, especially smaller ones or those in lower resource settings, just don't have the capital or, frankly, the physical space for it yet.
That brings us right to the people wearing this gear day in, day out. We've talked big picture, supply chains, environment. But what about the direct impact on healthcare workers? Are usability challenges still a major factor? Is the industry listening?
This is such a critical point because it hits everything. Worker well-being, compliance, even productivity. During the peak of the pandemic, we heard endless stories. Nurses with pressure sores from masks that just didn't fit right, doctors dealing with fogged up face shields for hours on end.
Yeah, that sounds incredibly difficult.
It is. Prolonged use, often during these incredibly long shifts, it causes real discomfort. Skin irritation, heat stress, sometimes it even reduces mobility.
And that can't be good for doing the job.
Exactly. These aren't minor inconveniences. These physical constraints can genuinely lead to lower compliance with safety protocols. If something is too uncomfortable, you might adjust it improperly. And it definitely impacts productivity, especially in high-pressure places like an ER.
So what's the solution?
Well, it's forcing the industry, finally, to really pivot. There's a growing demand now for PPE that isn't just protective, but is also designed with the user firmly in mind. Ergonomic, breathable, truly adjustable.
That makes perfect sense. Okay, so problems, challenges. But the industry isn't just sitting still, right? We are seeing some really interesting trends emerge. How are innovators responding to those cost and environmental concerns we just talked about?
Yeah, what's fascinating here is this definitive shift towards reusable and sustainable PPE solutions. It's really gaining momentum.
Like what specifically?
Well, to tackle both the cost issue and that huge environmental footprint, manufacturers are increasingly offering things like reusable face masks, gowns, even face shields that are designed to be safely sterilized multiple times without losing their protective qualities.
Interesting.
And it's not just a niche product here or there. We're seeing a wider adoption of green procurement policies in healthcare purchasing. Eco-conscious product design is starting to become maybe not the norm everywhere yet, but certainly a standard consideration rather than some kind of optional extra.
Okay, that's a positive step on the sustainability front. But beyond that, I keep hearing buzzwords like smart PPE. What exactly is that? How is tech changing these, traditionally pretty basic protective items?
Smart PPE. Yeah, that's truly emerging as a potential game changer. It's
Yeah.
basically integrating technology to move beyond just passive protection.
Okay, give me an example.
Sure. Imagine face masks equipped with tiny sensors that can monitor the air quality around the wearer, maybe even detect specific airborne pathogens. Or think about garments with embedded bioimpedance sensors, tracking vital signs, heart rate, respiration in real time.
Wow.
We're also seeing integrated safety alerts. Maybe a warning if a healthcare worker enters an area with known high exposure risk based on environmental sensors.
So it's not just a barrier anymore.
Exactly. These innovations are transforming PPE from just static barriers into, well, proactive tools. They can leverage data analytics to monitor exposure levels accurately, maybe improve compliance by giving immediate feedback to the wearer, and even inform critical health decisions,
That's clear.
potentially enabling things like predictive maintenance for the gear itself or running real-time risk assessments.
That is genuinely transformative. Okay, one last area. Thinking back to those supply chain vulnerabilities we discussed, the ones the pandemic really highlighted. What's happening with local manufacturing and strategic stockpiling? Is that shift sticking?
Oh, definitely. The pandemic was, I think, an undeniable lesson in the risks of relying too heavily on distant, complex international supply chains for critical items.
You could say that again?
Right. So in response, governments and major healthcare organizations, they aren't just patching holes temporarily. They're making significant strategic investments, building up domestic production hubs, fostering regional manufacturing ecosystems.
So less reliance on one or two countries far away.
Precisely. And the goal isn't just about being ready for the next big emergency, although that's part of it. It's about building a more resilient long-term strategy. This includes establishing national and regional PPE stockpiles, not just as a temporary fix, but as a permanent piece of the healthcare infrastructure puzzle.
To ensure a more secure supply.
A more secure, more consistent supply of critical protective equipment, ideally one that's less vulnerable to those sudden global disruptions.
Okay, so wrapping this up, this deep dive really shows the healthcare PPE market is in the midst of this rapid, profound evolution. You've got heightened safety awareness, these ongoing infectious disease threats, stricter regulations really pushing it forward. But at the same time, it's grappling with these significant restraints, volatile material costs, the huge environmental question mark around waste, and these really critical usability issues for the workers themselves.
Yeah, those tensions are very real.
But it's not static. The industry is actively navigating this, right? With innovation in smart PPE, this growing focus on sustainable options, and a clear move towards regional resilience and stockpiling really gaining traction.
Absolutely. It's a dynamic space right now. And this, I think, leads us to a really important question for you, our listener, to maybe chew on.
Okay.
How do you think global healthcare systems are ultimately going to balance these competing demands? You've got the immediate need for absolute protection on one hand. Then there's the crucial long-term goal of environmental sustainability. And critically, the need for ergonomic comfort for the actual healthcare workers wearing this gear day in, day out. How will that balance be struck as all these innovations continue to unfold?